High pain demands attention. We said the very first part of that is that orientation and focus of attention to remember anything. And yet, as you can see from this slide, that's really distracting. It keeps pulling your attention from what you're trying to attend to. So pain itself is very competitive, and often it takes our focus first. So high pain grabs our attention. We'll do very superficial processing of anything else. So that first step, getting it into the box, it doesn't get into the box. Details from a conversation doesn't get into the box. Details of the time and date don't get in the box because pain gets in the way. We also notice that people with pain often overestimate their problems. So the problem they're having with attention or memory, because that memory lapse has happened, they're now much more alert or vigilant for it. The reality is people forget words every era of life. Adolescents forget words on occasion, young adults, middle-aged, older-aged, all forget at times. But when we're younger, it's just annoying. When we're older and we have pain, we start to really worry, is this part of the pain problem itself? If they're telling me there's brain changes with pain, is it actually getting in the way of the structures that deal with memory? And poor sleep. People with chronic pain sleep poorly. 50 to 70% of the people with chronic pain state they either can't fall asleep, they can't stay asleep, or even if they do both, they don't feel rested when they wake up in the morning. They're tired all day, and it's a fight to focus. And we know that that tiredness affects getting things into the box and getting them out of the box. And medications. Some medications cause sleepiness. So we're drowsy, so we're not as attentive, we're not doing that orienting as we should to help us put things in memory. Strong painkillers like morphine, like oxycodone, OxyContin, all of those are sedating. So are some of the antidepressants. They're somewhat sedating, and they can get in the way, particularly depending on the time of day that you take them. Sleeping pills in particular, they're sedatives, so they definitely interfere with that attention process. And even some taken for spasm, like Flexeril or Baclofen, can have an impact because they're sedating. Other medications themselves, so certain antidepressants and the anti-seizure or anti-epilepsy medications actually interfere with the laying down of memories at the chemical level at the brain. So to start, sometimes when we first go on these medications, they can interfere with memory. What we hope is after a few days that that impact starts to ease. And if it doesn't, as I said before, it may be something to look at whether this is a good fit for you, or maybe your dose could be shifted so it has less of an impact. And not all medications affect attention and memory the same way. Sometimes it's about doses, so timing or combination of medications or moving to a higher dose. It was okay at a lower dose, not so good at a higher dose. Even your pain level can have an impact. So if you're on that medication that challenges memory a little bit and then your pain is higher that day, that could wind it up so it has a stronger impact. And depression and anxiety. They're common responses to chronic pain, and often they also interfere with ability to attend or to remember. So we know studies of people with chronic pain show that the more severe the depression or anxiety, the more severe the problems with attention and memory. And they often play a part in flare-ups of pain and sleep problems, which again wind up and have more and more of an impact on our ability to attend. So putting it all together, attention and memory problems are common, very common with people with chronic pain. They're often temporary. They may be related to higher pain in the moment, other things that are going on, poor sleep, medication combination. But there isn't something wrong with your brain. It's not something that's changed in the structures that is a challenge to your memory. It's part of the process of getting things into or out of the box. So, knowing this, there are ways to get the most out of the abilities that you have. And part of it may be looking at ways to decrease the impact the pain is having on you. If you can have some influence on the pain, then they may be able to pick the time of day that you're feeling the best, and that might be when you do things that require more attention or memory. So We'll looking at exploring medical options or rehabilitative options or self-management options for dealing with your pain. Improving your sleep, exploring sleep habits, using good sleep hygiene as we call it, so making sure that you have a routine to sleep, the room's dark, quiet, the right kind of temperature. All those things can help improve sleep, which would then take a little more challenge off your own ability to focus or remember. And also treating depression and anxiety. If those are things that you're struggling with, then is there a way to address them more directly, perhaps through relaxation training, psychotherapy itself, self-monitoring, tracking triggers for pain or mood, looking at medications or communication skills that might help address these and then take that challenge off the memory. Learning ways to decrease stress. We know higher levels of stress contribute to pain, poor sleep, anxiety, depression, all of those very negative things. So if we can improve our ability to manage stress, then we may be able to use that to our advantage for remembering and focusing attention. And also talking about medication side effects. If you don't talk about the problems with them, then your doctor and your pharmacist assume that you're doing okay. So if there's always one thing we really encourage people to do is give us feedback. We don't care if it's negative or positive. Without good feedback, there can't be changes to your treatment, so it better targets what you need. It matters if you can't remember. It matters if you can't pay attention. So these are not things to ignore or put up with because of your medications in case there's a better fit. And the healthy lifestyle itself, having the right level of exercise, having a good diet, are part of what helps us pay attention and remember. And specifically talking about diet or nutrition, there are actually things you can eat that help your memory itself. So you can improve the ability of brain cells to communicate by the actual diet that you have. And you can also limit the challenges to the brain through oxidation or inflammation by, again, the food choices that you make. And oxidation is a term we've often heard, oh, this is an antioxidant, or that's an antioxidant. And it's like, well, that sounds good. I have no idea why, but it does sound good. So this is why. Oxidation, if you think of rust on a nail, that's oxidation. So we don't actually have rusty nails in our bodies, but what we do have in our body is something called free radicals. These are highly active molecules, and they oxidize or damage cells. So less is better. So antioxidants are ones that protect us from this process. So the more foods we can eat that have these antioxidants in them, the more boost we give to our body to stop that oxidation or damage. So these plant chemicals or antioxidants, they show up most in fruit and vegetables that have bright, vivid colors. So, purple is good. We want purple fruits like blueberries, cranberries, grapes. And I'm thinking we're talking grape in the grape form, not the liquid form, I'm afraid. Bottom line is the more colorful it is, the deeper color it is, the more it is helpful for you to eat it. So fruits, vegetables like berries, cherries, plums, spinach, kale, broccoli, all of those are things that boost that. And inflammation. Inflammation, all over systemic inflammation, can have a real impact on pain levels, on the brain functioning itself, and that combination can challenge attention and memory. So anything high in saturated fats or cholesterol or refined sugars has been linked to increased inflammation. So the donuts have got to go, I'm afraid. And inflammation in the brain has been very clearly linked to memory loss.